get started in 2 minutes, folks. Thank you. He's on camera. Is he on live?
Yeah.
It's 102. Okay, John.
Good afternoon, everybody. John Ward, Director of Emergency Management here in Clay County, coming to you live from Unified Command, where we're working in partnership with the Department of Health and many other agencies working towards the COVID-19 response here in Clay County. Just really want to briefly talk on a few numbers and some points as we've been working through this event that I want our citizens to be aware of. Currently, we have 168 positive cases. We've had 9 fatalities, and Clay County still mourns along with the families of those 9 residents. To get the most up-to-date numbers here in Clay County, we ask that you go to the Department of Health dashboard, and those numbers are updated at 11 a.m. and 6 p.m. for the most up-to-dates. I just continually want to push Clay County as to the hardworking residents or the hardworking employees of many agencies that have been working 35 days straight, many long-hour days towards this response here in Clay County. And I want to call out one of our special departments, and that's our county IT department. They pulled off a phenomenal remote Board of County Commission meeting yesterday, and I just really want to congratulate that team that's been working hard to make that a success for us, and we appreciate that. I do want to address one thing, and this has to do with nursing home facilities here in Clay County. We do have positive cases in nursing home facilities. However, we will not be mentioning the name or numbers of what's in each facility. That is just as we would never say John Ward, who lives at 2519 State Road 16, is a positive case. That is their home, and we're not going to mention the facility or the numbers at each facility. We are working closely with state and facility leadership on managing the cases, working with the patients, and testing other patients that are in these facilities. We have a state incident management team that is now in Clay County. This state incident management team is made up of highly trained assets across Northeast Florida that are working for the state, and they're assigned to the Clay County Emergency Operations Center. This team currently is made up of 4 incident management team or 4 management team members, 21 nurses that are split up to assist in testing at various facilities, and 3 infectious control preventionists that again are around both Clay County facilities, but then they will also be working across Northeast Florida with the multitudes of our regions here in Clay County. This staff is working in our facilities and is assigned in facilities for the next 30 days.
There's an audio problem, John.
Okay.
He's going to just...
Okay, we're going to continue on. My apologies, technical difficulties. The staff that is working in these facilities will be here for the next 30 days, as will the team be in theater here in Clay County for the next 30 days, working with the surrounding counties across our region. Stop the Spread is working. The same number of cases as what we've been saying is going to come, which is carrying this on longer. The peak of this is unknown. We keep saying it could be the week of the 21st, but it's unknown at this point when that peak is going to be. We are just we just want to make our citizens understand that this is still going to take a few weeks still. And then when we get to that peak here in Clay County, it's not going to shut off like a light switch. It is going to take a few weeks on the backside to start getting into that recovery mode. I've been told by my partner at the Department of Health, we've decided to set a goal for we're going to plan a big barbecue for Memorial Day. So we're hoping to have that start getting back to some sort of normalcy by Memorial Day, and we're going to plan a barbecue for Memorial Day. The physical distancing is what we really want to push here in Clay County. We're starting to see a little bit of complacency. Remember, 6 feet in between us, no groups of 10 or more, and don't be complacent as this time goes on. Remain calm. We're going to get through this, Clay County. I want to talk food commodities now. We've been working very closely with our food banks here in Clay County and supplying them with food from commodities we've been receiving from Feeding Northeast Florida, Feeding Florida, and other donations that we've received from some of our businesses in the area. To date, the senior centers last week, the seniors fed 1,548 seniors. The schools fed 6,487 kids, and our food banks fed 6,665 people, and that's totaling right at 14,700 residents that were fed last week. Just to kind of talk about some changes that our residents may see, and that is starting by the end of this week, beginning of next week, we're going to start doing a registration process for our food banks here in Clay County, and that's going to enable us to start tracking our numbers. As we're working with our state and federal partners, they really want numbers and justification, so we're really trying to help provide that justification. This is not going to be sharing any of your personal information. I just need to prove numbers. So we're going to have an online registration system that we're going to be working that with, and then we're also going to have the phone center set up so we can register folks through that also and capture that. And then the other thing too, after speaking with my human services folks this morning, is we're going to start seeing some pop-up produce giveaways. Again, they'll be registered, but we're going to have some additional places set up, hopefully by the end of the week, where we're going to be giving away some additional produce. We're getting a lot of produce in from Feeding Northeast Florida, and obviously that's a struggle to try to give it away. It's not as easy as shelf-stable meals or dry goods or anything along those lines. If you want to volunteer, please feel free to call our volunteer center at 877-252-9362. We have volunteers that are out helping deliver food, that are working with the food banks, and that are working in our distribution warehouse. So please feel free to call that number. One thing I do want to make mention is changes to the call center, as we are seeing very low call volumes on the weekends. So we're going to go ahead and scale that call center back, and that's going to change starting this weekend. It's going to be Monday through Friday, 8 to 5, and we're going to monitor the call volume. The number will still be there to be answered. We're just not going to have a full call center set up on Saturdays and Sundays. If the call volume increases, we can always be flexible and stand that back up. Again, so far to date, we've fielded 4,727 calls for service or questions into our call center. So we appreciate our citizens calling in and trying to get the correct information. And one final note on the correct information is please go to alert.claycountygov.com to get the most updated information from the CDC, Department of Health, and those type things. We really want our citizens to have the most up-to-date information and not believe some of the false information that's being shared on social media. So what I'd like to do now is I'd like to call up Heather Huffman. Clay County, thank you. Stay strong, remain calm.
Thank you, John. Thanks for your leadership and partnership throughout this event. Just give you some updates on the information. So our cases, just to give a little bit of correction from John, we do actually have 170 cases. 2 of those are in non-Florida residents, and so that's where that difference is in numbers. So currently, we still remain at 9 deaths, and I'll talk a little bit more about the mortality rate in just a minute. We've had negative test results of 2,049, and we've had over a total of 2,200 total tests that have been completed. So far, we've had 39 hospitalizations. If you look at that Florida dashboard for COVID-19, when you look at hospitalizations, that does not mean currently hospitalized. That means ever hospitalized for this event. And so we want to be very clear that that does not mean or represent those that are currently hospitalized. It's just that they have been hospitalized at one time throughout this event. The mortality rate in Clay County related to this and the number of positive results that we have is currently around 5.4%. Unfortunately, this novel strand of coronavirus has been a little challenging with us to figure out who's it's going to impact and who is it going to impact in a poor outcome. And so We've been very unfortunate in this in Clay County that it has impacted individuals that have had underlying medical conditions that has resulted in a poor outcome. And so that is why our numbers are where they're at. As we test more and we unfortunately will have more positives that, we don't have any more deaths, that relates in a lower mortality rate. We continue to work with our long-term care facilities, as John Ward spoke about. We continue to do those assessments in those facilities from the onset of one case and beyond. We look at their infection control practices. We look at things like their entrance and exits within the building. How are they assessing staff when they come in? Are they taking temperatures of those staff? And then looking at simple infection control practices like the use of PPE, the proper use of PPE, and then things like hand sanitizing, hand washing, isolating individuals who are feeling ill, reducing the amount of congregational areas, dining areas, activity areas. So we are continuing to work with those facilities. They are the ones that hold and host many of our vulnerable populations, especially of those of 65 and older. So we're continuing to work with those facilities. We do provide twice a week calls with those facilities, ask them about their unmet needs, ask them about their PPE needs, ask them about any concerns they may have, not only with their residents in the facilities, but with staff that are supporting those residents. When we talk about the data that we have in our county, we have also been having calls with our hospitals to really look at what their capabilities are. And just to give you a visibility of where we're at today, we currently have about 25% of our total beds have availability at this time, and over 73%, a little over 30%, there is availability of the ICU beds. So we're continuing to monitor that within our acute care facilities so that we have visibility of that, and then looking within those for our surge planning. So lastly, just talking about individuals and testing sites, that question keeps continually coming up. Lot J in Jacksonville has now moved from a federal testing site to a state testing site. That means the ones that are actually performing those functions that are now state assets, usually it's the National Guard there. They are continuing to test individuals on a daily basis. The amount of maximum number of tests has been increased from 250 to around 400 a day, so there's more capabilities and capacity there. And the eligibility for testing has expanded. So it's not only those first responders and anybody that has signs and symptoms of COVID-19, but it also, now you can go without signs and symptoms to that testing site as long as you are stating that you have been in close contact with someone that has been tested and has had a result of a positive COVID-19. Fever is not one of the signs and symptoms that they're looking for now. That is not required on site to have in order to be tested. We continue to send individuals there. So this is a regional asset. So it is for not only Duval County, it just happens to be located in Duval County, and that is not only for Clay County, but the other surrounding counties. So this time I will introduce Mr. Howard Wanamaker.
All right, good afternoon, ladies and gentlemen. John, Heather, thank you for your latest updates, as always, spot on. I want to take a moment to thank each and every one of you for doing your part during this unprecedented pandemic. I know that it hasn't been easy, but please stay at home, physical distance yourself from others, and venture out only to conduct essential services and activities. We must continue to protect those that are most vulnerable. As John mentioned earlier, yesterday we successfully held our first ever virtual Board of County Commissioners meeting. We will continue to have these meetings, and our next scheduled committee meeting is Finance and Audit. It'll be held on Tuesday, April 21st at 3 p.m. It'll be broadcast on Comcast Channel 260, our website, and Facebook. And more information about this can be found on our website, claycountygov.com. Finally, we know this is an extremely stressful time for us all. There are many resources out there to help us during these times, and I want to encourage you to take a moment to focus on these resources, especially your family, your friends, and loved ones. The bottom line, take care of yourself, and remember, it's okay not to be okay. So let's continue for us all to do our part to stop the spread of this virus. I thank you all, and now I'll open up for questions. Yes, ma'am.
We're reporting positive cases at assisted living facilities and nursing homes. When someone tests positive in those spaces, what then is the protocol for other members who live there as well as staff?
Okay, I think Heather is the best person to answer those. They're pretty detailed. Thank you.
So what we do with any infection control practices within a facility, if that's acute care or long-term, when we identify an individual who's positive, we go in and self-isolate that individual. So if they're in the room with another member, another resident, if they're sharing a room, we will of course always look at contact tracing with that individual, but we'll also isolate the one that is positive and remove their roommate from that room. So we want to make sure that we're doing that. And then we do contact tracing back there. And we don't necessarily go immediately to testing for the other roommate in the room, but we then look at for signs and symptoms, and we do self-isolate the other individual away from the positive because they may not have contracted it or they may have. So all we can do is separate the two of them, keep them by themselves, and do those good infection control practices.
How does that change or stay the same when it comes to staff?
So give me an example of what you're referring to whenever you say when it comes to staff.
Well, there's people at these nursing facilities who they change the sheets, they may be helping transport patients or people who live there who may have trouble walking. Anyone who is working at those facilities that could have also come into contact with that person or somewhere that person has been.
Correct. So again, they use the PPE, the personal protective equipment. If they're using them, all of those that are available, your masks, your gowns, your gloves, shoe coverings, all those that are available to you, you're using them properly, then we consider you at no exposure or very limited exposure. The main thing is that they're using PPE properly. They're using new, clean, fresh PPE with every resident they come in contact with, and they're not just simply wearing PPE and going room to room to room where they could also transmit it within them. And doing proper hand washing in between residents is essential.
Are we worried about any shortages of PPE in these facilities or in our health facilities?
So what we've been doing so far with John Ward, we've been working with logistics out of the Emergency Operations Center and the State Emergency Operations Center to be able to get those resources in our county and provide those to our long-term care facilities, but also to our hospitals. We continue to have those 2 times a week calls, so we're looking at those unmet needs within those facilities, but we've also done pushes to them of PPE, and then they also have the opportunity to email us in any of their needs that are in between those calls or any time that we have those conversations, and that's emergency. Do I need to give that email address? No, sorry, that's for the long-term care facilities, so, thank you.
Can you talk about city employees that tested positive for COVID-19?
A city employee?
Yeah, you got a report that city employee got.
I don't have any information about that, and the only city that we have here would be Green Cove Springs. Are you referring to that city?
Yes.
I have no information on that. Any other questions that we can answer for you today? Okay, thank you so much. We appreciate you coming.